Today we are going to discuss about gonadal hormones. We continue the last topic. These are steroids. Steroids are nothing but the derivatives of cholesterol. These are called androgens. Three. Testosterone, estrogen, and progesterone. Testosterone is the male androgen. This one are called female androgens. Let's discuss about testosterone. Let's discuss about testosterone. Testosterone is the male androgen produced in the Sertoli cells in the presence of LH, interstitial cells of Leydig. It has two functions in male. First, it helps in spermatogenesis. Second, it helps in the development of secondary sexual characters in male. Secondary sexual characters in males means formation of acne, muscular changes, change in the voice, and the formation of pubic hair and axillary hair. Secondary sexual characters. Secondary sexual characters. Testosterone shows a negative feedback mechanism on LH until puberty. Now let's discuss about female androgens. Female androgen is estrogen. It is produced in the presence of LH in the corpus luteum, the graphene follicle. It has important functions. First one is it helps in the formation of a breast. It helps in the structural formation. Further, it will act with progesterone and develops breast tissue, structural development. Important point is it has vasculoprotective function. Protective function. This is the reason why in females the heart complaints are very less when compared to the males. It prevents from atherosclerosis, that is coronary artery disease. And the third function is helps in the development of secondary sexual characters. Helps in the development of secondary sexual characters. Next, helps in the preparation of lining of uterus along with the progesterone. And this shows a positive feedback mechanism on LH before ovulation, that is during LH surge. Estrogen helps in the increases bone formation. This is the reason why in the post-menopausal women there is a high chance of osteoporosis, because after menopause there is decrease in the estrogen levels that leads to the bone deformation, that leads to osteoporosis. There are important functions of estrogen. One, breast structural development. Second, prepares the uterus. Third one, it has vascular protective function and increases the bone formation. With the secondary development of secondary sexual characters, it shows positive feedback mechanism on LH during LH surge. Okay, let's discuss about progesterone. let's discuss about progesterone. What are the functions of progesterone in females? Progesterone is also called as a pregnancy hormone. What is the main function of progesterone? It helps the transformation of endometrium to the secretory phase. In this, it is ready to be implanted of ova during pregnancy. If there is no pregnancy, the progesterone levels are decreased. Then there is no support for the endometrium. Then it shed off. That is called menstruation. It is also called progesterone withdrawal bleeding because there is a decrease in the progesterone. So that's why here shedding off is occurring. So that's why it is also called as progesterone withdrawal bleeding. Let's see the second function. It helps in the functional development of breast. That is lobulo-alveolar development. Lobulo-alveolar development. Structural development is done by the estrogen, and here functional development is done by the lobulo-alveolar development. Lobulo-alveolar. That's third. It helps in the fetal ejection reflex. It helps in the fetal ejection reflex during parturition. That is, the child comes out. That is called parturition. It is produced in the corpus luteum. It is it contains highly lutein cells. If we see what happens if the progesterone level decreases, let's see. If progesterone level decreases, what happens? Pregnancy doesn't occur. During the pregnancy, the progesterone levels are decreased because that's why there is no lactation. During pregnancy. After a pregnancy, progesterone levels are again increased, then lactation will occur in females. Progesterone levels decreases, so that's why here there is no complication of a second pregnancy. If second pregnancy occurs, then also the progesterone levels has to be maintained normal. But here the progesterone levels are decreased, so that's why there is no second pregnancy. And this progesterone shows a negative feedback mechanism on FSH and LH because there is no development of follicle. Another development of follicle because already here is in pregnancy condition. Why the maternal parent, female, immune system doesn't respond for the foreign bodies, that is, fetus is also foreign body, but here the progesterone level decreases and this decreases the immune response of the maternal, mother. So that's why the foreign bodies having foreign bodies is also no problem in the female during pregnancy. During pregnancy, the progesterone levels, during parturition, the progesterone levels is decreased and estrogen levels are increased. This imbalance leads to the fetal ejection reflex, that is parturition. These are the functions of the progesterone in females. Okay, let's discuss. We'll continue next class about female reproductive organs. Okay.